When stress is identified and dealt with, panic and accidents can be avoided. But what happens if stress and panic are not stopped? In this instance, you may need to step in as a rescue diver and take charge of the situation. This process can be defined as accident management, or your ability to control yourself, the victim, the surrounding witnesses, and the emergency personnel during a diver rescue. While prevention of stress will always be your #1 priority, preparation in the area of accident management may be the difference in saving someone's life. Before you leave for your dive destination, you should prepare an emergency procedure list for your destination. You should know who to contact in the region in the event of an emergency, as well as the nearest emergency medical facility. If you are diving locally, you may simply need to know how to contact the local emergency medical services. In the event of an accident, you, as a rescue diver, will need to coordinate any available personnel to help. If there is someone more qualified on the scene, make yourself available and follow instructions. Because mental strength is important to the rescue, you will need to constantly monitor yourself and know when you've reached the limits of your abilities. When you begin to tire, it is time to get help. If possible, assign someone to record the rescue proceedings so you have an accurate record of how the incident occurred and the treatment that followed. This will aid medical personnel with further treatment and will help in the event of an investigation. In any life-threatening emergency, the person administering first aid must be able to evaluate the victim's condition. The easiest way to check a victim's vital signs is through the use of the first aid ABCs. A for airway. Be sure there are no airway obstructions and open the airway. B for breathing. Look, listen, and feel for air movement. If the victim is not breathing, give 2 breaths. C for circulation. Check the victim's pulse. If you do not detect a pulse, begin cardiopulmonary resuscitation, or CPR. Begin and continue CPR on a victim that has no pulse until help arrives and relieves you. If you are trained to use an automated external defibrillator, or AED, and have one available, prepare the victim for its use. Every rescue diver is required to be trained in first aid and CPR, and should be trained to use an AED. SSI recommends the React Right Adult First Aid and CPR program for first aid and CPR training. Through the React Right program, you will learn detailed first aid and CPR techniques that will allow you to save lives in the event of an emergency. If the victim is conscious, have the victim lie in a comfortable position and administer oxygen if a compressed gas injury is suspected. In a diver emergency, follow the 5-minute neuro exam provided in your SSI Diver Stress and Rescue Manual and Accident Management Slate. This exam can be done in the field, but is more accurate if the rescue diver has received proper training on how to perform the exam. Because your medical expertise and resources may be limited, you should simply do your best to stabilize the victim and keep him or her comfortable until you can get them to a medical facility. When it comes time to transport the victim, you will need to decide the best method of transportation. Ground transportation is the most common. However, if the medical facility is far away and time is of the essence, you may have little choice but to airlift the victim, most probably by helicopter. When turning a victim over to emergency personnel, you should be able to relate the details of the accident and the immediate care that was delivered, as recorded in your accident record. Proper accident management skills will help you make the difference for a successful rescue. Typically, your diving days will be filled with diving fun and adventure. The skills you learned in your open water diver course, such as buoyancy control, will allow you to relax and have a safe dive. Should an emergency occur, you should be able to help yourself through self-aid. By stopping what you're doing, calming down, and taking several deep breaths, You should be able to relax and make a rational decision about what action to take. Of course, any self-aid skill will be performed more easily with the help of a buddy. So, a buddy assist is made when a diver needs help in a stressful situation, but is still under control. Buddies are a safety essential. In addition to offering help, be sure and ask for it when it is needed. Buddy assistance is most valuable at the end of a dive, when a diver may be fatigued. If your buddy is unable to swim back to your exit point, you may want to help with a simple tow. In towing, it is important to remember to use positive buoyancy, to stay in constant communication with your buddy, and to ditch any equipment that hinders the tow. Side-by-side towing is the most common method for calm divers. By holding your buddy's underarm, you can maintain physical and visual contact and maintain communication. With this method, you actually push the diver through the water by their feet. This allows the diver to relax in the water, while you swim comfortably on your stomach. A surface float or other piece of equipment can also work for towing. The surface float works well with a panicked diver because it keeps you and the victim separated and allows the diver to keep their head above water so they can get under control. Towing your buddy from behind is the least popular method, but may be your only choice with a panicking victim. Stay out of the victim's reach by keeping their cylinder in front of you. Tow the victim by their BC, valve, or wetsuit. Should you need to perform a buddy assist, you should keep in mind the following safety points. These points are covered in further detail in your SSI Diver Stress and Rescue Manual. To begin with, approach the victim so he or she can see you, but maintain a safe distance. Once you assess the situation, make physical contact. This may be enough to calm the victim. On the surface, use positive buoyancy by inflating the BC and ditching the weight system if necessary. You will need to find out what is causing the problem so you can attempt to solve it. Once you have stabilized the victim, go ahead and tow him or her back to safety if necessary. Most stress situations can be handled by either self-aid or buddy assist. If the stress is dealt with immediately, the dive can go on, and you can both enjoy a pleasant day of diving.